Hi there, Doc Davis, orthopedic spine and neck specialist. Here's what you need to know about lumbar spinal stenosis. Lumbar spinal stenosis is a condition that involves narrowing around the nerves in the lower back. There can be several causes of narrowing on the nerves in the lower back. Some of these causes include a degenerative disc that allows disc collapse and closing of the spinal canal, spondylolisthesis, where one vertebrae slips past another, narrowing the opening for the nerves, a disc herniation, or arthritic bone spurs. If you develop narrowing of the spinal canal, putting pressure on the nerves, this can cause back pain, leg pain, or a combination of back and leg pain. Typically, symptoms from spinal stenosis are made worse with prolonged standing or walking. These symptoms a lot of times are improved with sitting down and resting. The reason for the worsening symptoms when you stand and walk is in an upright position, our low back is put in a slightly extended or pushed back position. This position fractionally narrows the spinal canal, adding extra pressure on nerves that are already pinched, causing them to be more symptomatic. One way you can make room for the nerves if you have lumbar spinal stenosis is to lean forward. And this is why a lot of times you'll see people with lumbar spinal stenosis leaning forward on a shopping cart in the grocery store. Symptoms that come from lumbar spinal stenosis include back and leg pain. Sometimes the symptoms can be localized to the lower back, where you can have sharp stabbing pain or back spasms that result from pinched nerves. Other times, when the nerves get pinched in the lower back from spinal stenosis, you can have pain, numbness, and tingling shooting down your leg into the foot and toes. If a nerve in the lower back is pinched significantly, it can sometimes lead to weakness, including things like a foot drop. There are several ways to treat lumbar spinal stenosis. Most of them do not involve surgical intervention. Low-impact aerobic exercise, physical therapy, and chiropractic treatment can be successful in treating patients with lumbar spinal stenosis. If you're experiencing significant nerve pain with lumbar spinal stenosis, an epidural steroid injection can be quite successful. In cases where your symptoms don't improve after these types of treatment, or if they get progressively worse, surgical intervention can help. In the majority of patients, surgery involves a simple decompression, which typically is an outpatient surgery. You're able to have the surgical procedure and go home in the same day, and the recovery is usually complete in less than 2 months. If your spine has significant structural change, occasionally a fusion surgery is required to give you the best outcome in spinal stenosis. If you think you have symptoms of lumbar spinal stenosis, schedule a consultation and I can help set up a treatment plan.